Hello and welcome back. Today we're going to look at hypertension. You always get questions on hypertension in the GPhC exam without a shadow of a doubt. So you will get questions in the exam on hypertension. But the question is, what areas you need to focus on? Again, in these videos, they are short because they're direct. They go straight to the key things that you need to know for the exam. And if you wanted more details, then you have to watch all the other videos and access my active recall notes there on the website. But today is all about the key areas to focus on. So what are the common areas that come up when it comes to hypertension in the GPhC exam? Number one, you need to know about pregnancy. They tend to ask you questions on pregnancy and hypertension. Then side effects, especially of your hypertension drugs, your calcium channel blockers, your beta blockers. You need to know side effects of these. Then you need to master your algorithm. They love asking you questions on the hypertension algorithm. This is where age comes in. Patients that are less than 55, what do you give them? Those that are above 55, Black Africans, diabetics, new drugs. So they'll ask you questions about what new drug do you need to add? What step do you need to add? What drugs you need to add at each step? So this is so important. So we're going to go through all of this in this video. So first I want to look at obviously pregnancy and hypertension. The key, you need to know the main medications that you give to pregnant ladies. And you also need to know the order at which you give this. So which is first line, which is second line, which is third line. So key drugs, pregnancy, hypertension and pregnancy. We're looking at first line is labetalol. They have given this question in the exam a few times. They may tell you a patient is pregnant and the patient is also asthmatic. In this case, we're not going to give them labetalol as first line. We're going to move down to our second line. And our second line is normally MR nifedipine. And then third line, if they cannot take nifedipine for some reason, it's going to be metal-dopa. So in terms of pregnancy and hypertension, these are the main areas that tend to get tested the most in the GPhC exam. So let's look at the next thing I want to show is a table which contains very important side effects that they love to test you on. So these are the next ones. You need to know your side effects of your drugs. So what I've done is I've put it together in a very simple table to help you. Again, remember, on the website, you can access all the slides and you could download and screenshot them. Not download, screenshot them. So side effects. The main ones we're looking at your antihypertensive drugs. You need to know side effects of ACE inhibitors, ARBs, calcium channel blockers, thiazide diuretics, spironolactone, beta blockers, and alpha blockers. These are the most common. So you need to know what to avoid. Cautions, for example, ACE inhibitors with African Caribbeans, risk of angioedema, patients that have got severe renal disease, pregnancy, you avoid ACE inhibitors. Side effects, hyperkalemia comes up along your exam, hyperkalemia with ACE inhibitors, hyperkalemia with ARBs, very important. When it comes to calcium channel blockers, definitely swelling, edema, avoiding heart failure patients. You could give amlodipine to an extent, but generally we avoid calcium channel blocker in patients with heart failure. Then your thiazide diuretics, avoiding diabetics, patients have got gout, EGFR less than 30. So these avoid and caution simply means it's not contraindications. Some could be contraindications, but sometimes it's just a caution. They love to test you on this. So they give you a potential question where a patient that's meant to have an ACE inhibitor as first line, for example, Caucasian that is 57 years old. So first line, you'll be thinking calcium channel blocker. But if this patient has got a history of heart failure, you're not going to give them calcium channel blocker as the first line. You'll probably go give them an ACE or a thiazide-like diuretic like indapamide. So this table is very important and they do love asking you questions based on this table here. So next thing is obviously probably the most important. You always seem to get questions from the algorithm. Questions could be in different ways. They could test you on this. A patient is diabetic. Doesn't matter if this patient is Black African, if it's Caucasian, whatever this patient is. As long as the patient is diabetic, we always give them an ACE or an ARB as the first line. If this patient is an African Caribbean, it's always going to be ARB in preference to an ACE. So I use this mnemonic ACT on one side and CAT on the other side. So this is my mnemonic that I use, ACT and CAT. So ACT, ACE inhibitor, ARB, if a patient cannot have that, or if you've optimized that, then you could give them a calcium channel blocker or a thiazide-like diuretic like indapamide. So on the other side, they might test you if a patient is above 55 years old, or perhaps the patient is Black African. If the patient has diabetes, you're going to give them ACT. You're going to come this way. But if a black African that doesn't have diabetes, then you follow this trend over here, which are calcium channel blockers first line. But the GPhC could test you and tell you it's a black African, but with a history of heart failure. In that case, we're not going to give them a calcium channel blocker. We will move down to the second line, which shall either be an ACE inhibitor or a thiazide-like diuretic, preferably a thiazide-like diuretic if they've got a history of heart failure. So it's very important that you learn this algorithm, you master them, you learn the previous table I showed you, because that's what they're going to ask you questions. To either test you on questions on optimizing what is the next step, or there's a contraindication, or it could just be a question just general about side effects about the medications. So please learn these, and as long as you learn this, then you're in a very good place when it comes to hypertension. So why don't we try a GPhC style question to round this up? So 29-year-old woman is 16 weeks pregnant, presents with persistent hypertension. She has a history of asthma. We need to circle keywords there, conditions. She has a history of asthma, which is controlled with salbutamol as needed. She's not currently on any antihypertensive medication. So which is the most appropriate antihypertensive for her? So she is pregnant. So we're going to obviously think about our main ones, labetalol first line, but we're not going to give this patient labetalol because this patient is asthmatic. So we've got to move to the second line, and the second line is obviously MR nifedipine. So the correct answer to this question will be MR nifedipine. Remember, guys, there's loads and loads of questions on hypertension on the website. I have loads of quizzes, GPhC style questions on hypertension, more notes in terms of my active recall notes on hypertension. So if you wanted more information, make sure you join the website and you access all this information. Stay positive, and I look forward to seeing you soon.